What are the symptoms of diabetes? I'm sure you can think of 3 things: excessive thirst, too much urine, and weight loss. And you're right. These 3 symptoms of diabetes have been reported since ancient Egypt. In this video, I'm going to talk about the 10 most important symptoms of diabetes. And the sooner we find out that a person has diabetes or prediabetes, the better, because we can avoid the consequences of diabetes. And if you are pre-diabetic, we can prevent you from becoming diabetic, and I'll tell you how at the end of the video, so watch to the end. But first, like the video, this is how you can help me. Diabetes is a very common disease. 1 in 4 pre-diabetics will become diabetics within 5 years. That's why this video is so important. The body attacks its own cells until the pancreas can no longer produce insulin. It can occur at any age, but is more common in children and adolescents, peaking between the ages of 10 and 14. Type 2 diabetes, which is the most common, has insulin resistance as its key feature, that is the insensitivity of the tissues for insulin. Your cells don't want insulin anymore. Unlike type 1 diabetes, the cells of the pancreas produce insulin, sometimes even more insulin than normal, but the production is inadequate to prevent hyperglycemia. In the past, we only saw it in older adults and the elderly, but today, with widespread obesity, there is a significant increase in children and adolescents. That's why I'm stressing here that obesity is the most important environmental factor for prediabetes, insulin resistance, and type 2 diabetes. What kind of obesity? Mainly abdominal obesity, visceral obesity, subcutaneous fat, which is less associated with insulin insensitivity. That's why we see the difference between apple obesity and pear obesity. In apple obesity, the fat is localized mainly in the abdomen, arms, and neck. In pear obesity, fat is stored in the lower parts of the body and is less harmful. An exercise changes where fat is stored, as we see in Japanese sumo wrestlers. They eat 7,000 calories a day, but because they exercise a lot, they rarely have diabetes or triglyceride problems, even though they are morbidly obese. Does genetics affect diabetes? Type 2 diabetes in particular has a strong genetic component. Studies of identical twins have shown that if one twin has type 2 diabetes over the age of 40, the other twin has a 70% chance of becoming diabetic within a year. Are there differences between the symptoms of type 1 and type 2 diabetes? There are some. In type 1 diabetes, the body can no longer produce insulin. It produces very little or none at all. Normally, glucose levels are much higher, and it's a more severe form of diabetes. So the symptoms are easier to see. It's more common in children. The child starts to eat a lot, but they lose weight quickly. They wet the bed, which they never did before, or they had stopped wetting the bed, but now they're doing it again. Or they can't hold it in, and they pee in class in their desks to their embarrassment in front of their classmates. The child becomes more irritable, starts fighting with others. The child who used to be quiet is now very thirsty and has blurred vision. And another important thing: type 1 diabetes can cause diabetic ketoacidosis, which is very dangerous and can lead to death. Ketoacidosis is an acute complication, typical of people with type 1 diabetes, and is associated with stressful conditions that lead to an increase in counter-regulatory hormones, such as an infection or missing a school exam, and the symptoms of ketoacidosis vary. Sometimes you have severe abdominal pain, nausea and vomiting. You can't even eat. Excessive weakness, shortness of breath, rapid breathing, as the body tries to get rid of excess acid by breathing. Mental confusion. Your breath smells like rotten pasta or rotten fruit. If you have any of these symptoms, you should rush to the emergency room. If in addition to high blood sugar, you have high levels of ketones in your urine. What are the signs and symptoms to look for if you think you might have type 2 diabetes? Symptom number 1: dark patches on the skin that form in the folds of the neck, armpits, groin that can be soft and velvety. You see the dark spots on your neck, you put ointment on it, it doesn't get better. It's not dirt, it's called acanthosis nigricans. It's due to the excess insulin that your body produces, which causes normal skin cells to multiply rapidly. And for those with dark skin, these new cells have more melanin, and this increase in melanin produces spots on the skin. Just look at your neck. Acanthosis nigricans is a strong predictor of diabetes. Symptom number 2, periodontitis. Periodontitis is a common chronic inflammatory disease characterized by destruction of the supporting structures of the teeth. It is characterized by swelling and redness of the gums, gum recession, soft teeth, and tooth loss. It has many negative effects on the quality of life, and diabetes is a major risk factor for periodontitis. It is about 3 times more common in people with diabetes. And look, the risk of cardiorenal mortality is 3 times higher in diabetics with severe periodontitis than in diabetics without periodontitis. So if you're diabetic or pre-diabetic, take good care of your teeth and gums. Everything in the body is connected. Symptom number 3, itching and fungal infections. Excess sugar in the blood and urine provides food for fungi that can cause infections. Fungal infections tend to occur in warm, moist areas such as the mouth, genitals, groin, and armpits. The affected areas usually itch, but the person may also feel burning redness and pain. Fungi feed on sugar. Keeping blood sugar levels in the normal range can help reduce the risk of fungal infection. Some types of candidiasis can cause serious complications if left untreated. Symptom number 4, blurred vision. Blurred vision can occur in diabetics, the person who used to see well and now sees blurry. That could be a symptom of diabetes. Why is that? When you have high levels of sugar in your blood, the sugar in your eye increases and draws water into the eye, causing the lens to swell and change shape. When the lens changes, the result is blurred vision and a lack of focus. And diabetes can also cause vision to darken when blood sugar levels drop too low in hyperglycemia. In terms of vision, diabetes is the leading cause of adult blindness worldwide due to diabetic retinopathy. Long-term uncontrolled diabetes damages the blood vessels at the back of the eye and the retina and can cause blurred vision. Symptom number 5, burning feet. Diabetes and prediabetes are the number 1 cause of burning feet. Why? Because of diabetic neuropathy. And we know that diabetic neuropathy can affect up to half of all people with diabetes. Some diabetics have mild symptoms, but for others, diabetic neuropathy can be quite painful and disabling. Symptom number 6, fatigue. According to the American Diabetes Association, 61% of people newly diagnosed with type 2 diabetes experience fatigue as a symptom. In fact, it's the second most common symptom. Why is that? Because the cells in your body may not be getting enough glucose and are running out of energy. But this exaggerated fatigue can also be caused by the diagnosis of diabetes, which causes anxiety, as well as getting up a lot at night to urinate, being overweight, which causes fatigue and even sleep apnea and snoring. Some diabetes medications, such as metformin, can cause B12 deficiency, which is associated with fatigue. Symptom number 7, excessive hunger. Diabetes can make you hungrier than usual, especially for sweet and sugary foods. And remember, diabetic hyperphagia is not the same as binge eating. With binge eating, the person eats an excessive amount of food, even when they're not hungry. And it's usually due to an emotional component. With diabetic hyperphagia, the person is constantly hungry whether they are eating or not. And why do they want to eat sweets? Because the body cells aren't getting the sugar they need. Symptom number 8, excessive thirst. Diabetes causes excessive thirst. When your body can't process sugar properly, your kidneys start to excrete sugar. And the sugar takes water with it. It dehydrates you. It causes osmotic diuresis. Your kidneys will produce more urine, which triggers a thirst response, which leads to drinking more water. and that thirst is usually accompanied by a persistent dry mouth. Symptom number 9, unexplained weight loss. This symptom is more common in type 1 diabetes, where insufficient insulin prevents the body's cells from drawing glucose from the blood to use for energy. When this happens, the body starts burning fat and muscle for energy, causing unexplained weight loss. Now, if you're experiencing glycosuria or peeing with sugar, you may also be losing weight because of it. The new diabetes drugs, SGLT2 inhibitors, can also cause weight loss. Symptom number 10, frequent urination. One of the first symptoms of diabetes is the need to pee more often during the day. You drink more fluids and get up more often at night to urinate. When there's too much sugar in your blood, your kidneys have to work harder to get rid of it. This forces them to produce more urine. Glycosuria, the loss of glucose in the urine, causes you to become dehydrated and drink more fluids, which reinforces this vicious cycle. But diabetes can also increase the risk of urinary tract infections, which can lead to polyuria. So you see, the symptoms are all related. You have the symptoms of diabetes, so how do you make sure you have diabetes? By doing a blood test. Fasting blood glucose is normal up to 99 milligrams per deciliter. If you're between 10-1125, you're in the pre-diabetic range. If you're over 126, you're diabetic, but it's not just the fasting glucose, the oral glucose tolerance test, where you have to take that sweet liquid. If it's at the normal level, it's up to 140 milligrams per deciliter in 2 hours. If it's between 1,141-199, pre-diabetic over 200, you're diabetic. And the HB glycated, which is the average of the last 10 weeks of blood glucose, is usually below 5.7. 5.7 to 6.4 is pre-diabetic, 6.5 is diabetic. Of course, a single test doesn't confirm whether you are diabetic or pre-diabetic, but you need to repeat the test to be sure. Now, let's talk. Do you have diabetes or pre-diabetes? What part of the world are you from? Write it down below. And an important part. I'll leave a link for you to click on in the comments below to our herbs and foods program with recipes that explain when to use them and how to get the most nutrients from foods that can change your life forever. By keeping your organs healthy, you can correct health problems with natural homemade recipes. So take a look, and then come back and tell our team what you think. Okay? How can we prevent pre-diabetes from becoming diabetes? This question was answered by the DPP study, diabetes prevention program, where they randomized more than 3,000 people with pre-diabetes into one of 3 groups. One group was a lifestyle modification group that had to lose 7% of their weight, eat fewer calories, and exercise 150 minutes a week. The second group used metformin 850 milligrams twice a day. In the third group, they gave a placebo, which was a flour pill, which was the control group. The lifestyle change group was the winner and reduced the risk of becoming diabetic by 58%, and the metformin group reduced the risk of becoming diabetic by 31% compared to the placebo group in 2.8 years. It is possible to prevent diabetes and, in some cases, to reverse it with weight loss and lifestyle changes. Did you like the video? Did you learn more about diabetes and its symptoms? I hope so. And what's the next video you're going to watch? I'll leave you with my recommendation. Until the next video. Thank you very much. Stay healthy.